The clerk will designate the amendment. The staff will distribute the copies of the amendment, and then I'm going to yield to Mr. Trone for 4 minutes of opening remarks.
Amendment number 8, being considered 7th on prescription drug costs, offered by Mr. Trone.
I yield 4 minutes to the gentleman from Maryland.
Thank you, Mr. Chairman. For far too long, Americans have paid more for their prescription drugs than citizens in any other major economy in the world. For far too long, prescription drug prices have driven up prices in pursuit of record corporate profits, forcing many Americans to choose between health care or feeding their families. But now, thanks to the Inflation Reduction Act, Democrats passed into law last December, which I hate to mention, no Republicans voted for in the House or the Senate, the affordability of marketplace health care has increased. The cost of insulin is capped at $35 a month for Medicare enrollees. And for the first time in history, Medicare can directly negotiate the price of covered prescription drugs to combat Big Pharma's price gouging, saving money for patients and taxpayers. Huge win, a huge win for Americans. In my home state of Maryland, the $35 monthly insulin cap has lowered the cost of out-of-pocket for over 21,000 Marylanders. Monthly marketplace premiums have been reduced by hundreds of thousands of dollars for roughly 153,000 Marylanders. Free vaccines have benefited 55,000 Marylanders. And Medicare Part D reforms will save residents nearly $111 million in 2025. These savings are changing lives for the better in our communities all over the country. And so for these reasons, we must protect the vital provisions under the Inflation Reduction Act and reject efforts to weaken this transformative law. That's why I urge my colleague to support my lower prescription drug cost amendment. This amendment strikes the language that threatens Medicare drug price negotiations and inserts a new policy statement on lowering prescription drug prices for American families. It's imperative we empower Medicare to negotiate drug prices so our seniors can get a better deal. Our seniors are depending on us to do the right thing, to lower drug costs and put an end to price gouging. I welcome your support. I yield the balance of my time.